Good morning, dear viewers. You are most welcome to the Daktari show, which will be airing on Westnile TV every Thursday from 10 a.m. to 11 a.m. You can get us on StarTimes channel 477 and Zuku channel 0073. I will be your host, Sunday Junior Tom, a student doing my Bachelor's of Science in Nursing from Moon University, and this show will be aimed at talking about the common diseases, the common health concerns which we are facing in our societies out there. We shall be discussing the epidemiology or the statistics, how it is in the country and specifically in West Nile. We shall be discussing how you can prevent primarily when you are out there home to prevent these diseases, the cures, and also the management, how you can live with these infections and diseases. I shall always be getting you hosts, guests from different places, the doctors, the nurses, the professionals, the dietitians, and they will be coming here on the show to give us information which we shall be sharing with you, the general public, about managing your health. So from today we are going to pick up from our discussion. Of recent we have had statistics from the Uganda National Institute of Public Health which showed that West Nile has over 450 people or cases suffering from malaria infection in 1,000 people, and also it showed that 63% of the inpatient cases are malaria related cases, and also 35% of these cases are of the inpatient cases are malaria related. And also they showed us that 4% of these deaths registered in the hospitals here in West Nile are contributed by this infection of malaria. And also we had a recent survey or research and report done by the WHO in 2021 which showed that Uganda registered over 13 million people cases of malaria, and also we had over 19,600 people have dying due to this endemic disease. So this raised a concern, and we said for today we shall have to have a conversation on malaria, and I had to get a good host. As you know, here we shall be getting you cream de la cream, people who are experienced, people who are professional, people who have the knowledge, people who have the guidance and wisdom which can be used to discuss and guiding us, educating us on how we shall be preventing, on how we shall be managing these various diseases. Today we have a host here, cream de la cream, Mr. Nsamba John Baptist, also a student from Moon University, who is going to discuss with us this conversation all about malaria, where we shall discuss about the prevention, the causes, the management, and the cures. You're most welcome to the show, Mr. Nsamba John Baptist.
Thank you, our presenter. Has already introduced me. I'm Nsamba John Baptist, a Bachelor of Nursing Science student from Moon University. Good morning, our dear viewers. Thank you for supporting Westnile TV and participating in this very entertaining and educative Daktari show at Westnile TV.
Alright, you are most welcome. Thanks very much, Mr. John. And also today we are going to have this topic of discussion, malaria. Hope every viewer I believe outside there has suffered from this endemic disease, whereby it could have put them down and they failed to go to their workplaces. Actually, some have lost lives due to this endemic disease. So, Mr. John, what is malaria in simple terms? Malaria is life-threatening infection which is caused by parasites, and these parasites are known as Plasmodium parasites, which are of different types, and this disease can be mild or it can be severe, whereby it can even result into complications, or if you act immediately after knowing that you're having this disease, you can easily recover from it without complications. That is in simple terms what malaria is. Wow, thanks very much, Mr. John. So how true there are some beliefs in the society? There are people who say that malaria could be as a result of poor sanitation, some believe it's witchcraft, some believe it is a punishment from God. How true are these beliefs on malaria to you as a profession?
Thank you, our presenter. Yes, there are a lot of beliefs in our communities which are related to malaria, but I want to assure you malaria is not as a result of witchcraft. However, some of those beliefs, like the poor sanitation, they can be a predisposing factor to this infection. However, the infection itself is just caused by parasites. As I said earlier, those parasites are called Plasmodium parasites, whereby you will inquire this disease in case you get bitten by an infected female Anopheles mosquitoes, the one which transmit those parasites from one infected person to the one who is not infected.
Wow, thanks very much, Mr. John Baptist. Also, to continue, some people believe that these medics or you people don't suffer from malaria or don't suffer from these diseases. How true could it be?
Malaria, what I can say about that, everyone on this planet is at risk of getting malaria. Therefore, even we medics, we are susceptible to malaria infections. It depends on how you've managed to prevent this infection, because I want to assure you this infection is preventable. You can minimize the risks of getting it through different preventive measures.
Yeah.
Therefore, also medics can get infected with this infection.
All right, thanks very much for that elaborate explanation. So viewers out there, I hope that belief is now taken off. Also, these medics can suffer from malaria. So Mr. John, what causes this malaria infection?
As I said earlier, this disease is a parasitic infection, whereby it is caused by parasites, and these parasites are specifically called Plasmodium parasites. I don't know how that parasite is called in our local language, but the parasite, its name is called Plasmodium parasites, which have different types. However, in our community, the more prevalent one is called Plasmodium falciparum, which is more endemic in our region, that causes these malaria infections to the people of our community.
Wow, thanks very much, Mr. John. So when we come to, we have already seen the causes, that it is this Plasmodium falciparum. So what could be the risk factors which can predispose someone who is out there viewing and they get exposed to get this malaria infection?
Some of the risk factors, I will basically say immunity. In most cases, as I said earlier, everyone is at risk of getting malaria. However, there are those different categories of people who are at higher risk of getting this infection. For example, children below the age of 5, pregnant women, the elderly, more especially those with different diseases like diabetes. We can also talk of the pregnant mothers. You will find that these people, as to why they are at high risk of getting these infections, it depends on their immunity. You find that those pregnant mothers, those elderly, their immunity lowers, whereby their immunity can't support or fight against these parasites in case they get them. And those children which are below 5 years, you find that most of them, it is their first exposure. They don't have secondary immunity against this disease. Therefore, that first exposure increases their risk of getting this infection, accompanied with their low immunity.
Wow, thanks very much, Mr. John. So these people are always at high risk, especially these pregnant women, because in the hospitals, actually, most of the malaria cases which are reported there, they are children under the age of 5 years, and also these pregnant women. Okay, away from that, someone may be wondering, where do these mosquitoes live such that they can come and infect someone in the household or in the homes where people are living?
Thank you, our presenter. We shall find that these malaria, these mosquitoes, which are capable of transmitting the parasite, the malaria parasites, to our bodies, they prefer areas which are warm and with some humidity. Therefore, we shall find that these mosquitoes, they mainly reside in like areas which are bushy, forests, and along the water streams, like along the river. But they can reside in those different habitats from where they can now come and enter into our houses. That is why in the beginning I had you telling us that the Western Nile region has a high prevalence of malaria infections, which I can relate to the environment or the climate conditions of our community. You find that in Western Nile region we're having a lot of bushes and the temperatures are always high, which favor the survival of these mosquitoes, increasing their risks of transmitting this malaria infection to our bodies.
Yes, thanks very much, Mr. John. At least now I know, and every viewer outside there has got to know why we have the highest prevalence of malaria here in West Nile. As our guest has told us, it is due to the environment. You know, our temperatures here in West Nile are a bit high, and this favors the growth and hatching of the mosquito eggs. Thanks very much, Mr. John.
You're welcome.
So to take you at something else, someone out there may be asking, how can just a mere insect or a mere mosquito bite me and put me down? How does this mere bite develop and progress in the body to cause those life-threatening symptoms and signs?
Okay, when someone gets bitten with an infected female Anopheles mosquito, that mosquito will now donate that parasite in your blood, whereby you find that those parasites, they will still be in their early stages of development. Those Plasmodium parasites, which we talked about earlier, which was malaria, and these parasites will now travel to the liver, where they will enter the cells of the liver and start maturing from there. Then after the maturation process, you will find that now these parasites will leave the liver cells and now enter the blood, whereby in the blood they specifically colonize the red blood cells, whereby they enter in the red blood cells. Those red blood cells are just part of the blood, which give that red component to the blood. Therefore, when they enter in those red blood cells, now they start multiplying. When they start multiplying, now eventually they will cause the death of those red blood cells, and those red blood cells are very essential to our body, whereby their major role is transportation of oxygen to different body organs. You will find that when these red blood cells are being killed by these parasites, it is going to stimulate the body's defensive mechanism to come and fight these parasites. Also, that death will lower the amount of oxygen being transported to different body organs, which will now result into those different presentations or symptoms, which you base on to say that someone is having malaria. That is how it does it in simple terms, not to go into the complicated stuff.
Alright, thanks very much, Mr. John. It has really been deep and understanding. I think almost we have been in a class, and also the viewers outside there have got to know how this infection develops in your body, just from a mere bite to get those severe complications. So maybe, Mr. John Baptist, to ask, when I'm home outside there, how can I know that I have malaria? What are those warning signs someone can get to know that I'm having malaria infection?
Okay, thank you, our presenter. As I said earlier, this disease can be mild or it can be severe. However, if the disease is still in its mild state or initial phase, we shall get general symptoms which are not specific to malaria, but however, we specifically say that it will be malaria based on the malaria prevalence in this West Nile region, whereby those key symptoms which you will base on, you will have fever. Fever, that is where your body temperature will increase. When you touch that person, you will feel that the skin is very warm beyond the norm. Then you will also see other symptoms like tiredness, someone being tired, getting muscle pain, joint pain, complaining of such symptoms.
All right. Thanks very much, Mr. John, for that elaborate discussion about the signs and symptoms of malaria. I hope our viewers, you are getting to know.
However,
yes.
To add on something, those symptoms are when the disease is still in its initial phase, those headache. However, someone can also present with nausea, diarrhea, vomiting, such symptoms when the disease is still in its initial phase or when it's still at mild stage. Then when it comes to complicated stage, then we shall see a lot of symptoms, including yellowing of the palm. You will see, if you are mother, you will check the palm of your baby or the sole of your baby's foot, then you will see when they are yellowing. You will start seeing the eyes changing color, like becoming bluish. You will see the inner part of the mouth also turning to blue color. Those are now we start suspecting complicated one. You will see when your baby is also experiencing difficulty in breathing, like you see the baby is using a lot of energy to breathe. Such complications can set in when the disease goes into its severe state. You can see all those symptoms among others.
Yes, thanks very much, Mr. John, for the symptoms. Hope we have gotten the early symptoms and also these late symptoms from the chronic infection of malaria. So maybe to ask Mr. John, there are some people who get like these signs and symptoms and they immediately rush to these drug shops and buy Cotam, Panadol, and they start taking. Are there other diseases which present with such signs and symptoms?
Yes, those initial symptoms which I talked about, fever, headache, tiredness, muscle pain, joint pain, those symptoms are not specific to malaria. You will find that almost among all infections caused by those organisms which we can't see with our naked eyes, they will present with such symptoms. Therefore, I would advise, if you see those symptoms, don't just rush to any nearby drug shop and buy medications without a medical personnel first investigating and get to know what is really happening, because you will delay this disease and you cause the weakening of those parasites, yet you are not taking the right dose, which will in turn cause that infection to reoccur in a severe state, which can now become very dangerous and difficult to manage, which can cost you a lot of money for you to manage such complicated malaria.
Wow. Thanks very much, Mr. John Baptist, and he has discouraged us from doing this self-medication. Just a moment, let's first get to a short commercial break where we shall come back in the second session and we talk about the preventive measures, the management, and also how you can help someone to not develop the complications of this infection. Thanks very much, our dear viewers. Let's get back shortly after this short commercial break. Thank you very much.
Westnile TV, lighting up the region.
Star TV with StarTimes Inside Technology. New TV innovation with an inbuilt decoder that connects you to both StarTimes antenna and satellite signal. With StarTimes Inside Global Star TV, you can enjoy over 300 local and international channels, 1 month StarTimes highest bouquet for free, automatic system update, more benefits, more affordable. StarTimes Inside Global Star TV is available in all StarTimes branches and dealers countrywide. StarTimes Inside, entertainment inbuilt.
Westnile TV, lighting up the region.
Welcome back, our dear viewers. We are still holding on to the Daktari show on Westnile TV. Those who have just joined us, it is still the Daktari TV and show where we have been discussing the malaria prevention and how it develops in the body, the signs and symptoms. So in our second segment here, we are going to talk about the diagnosis. When you go to the hospital, how do these medics get to know that you are having this malaria infection? Welcome back, Mr. John Baptist, from that short commercial break.
Okay. Thank you, our presenter. As we've already discussed a lot about malaria, now we want to know what happens when you go to the hospital and a medical personnel start suspecting malaria. Before giving treatment, we have to first do some investigations and assessment, whereby for us to diagnose malaria and put you on malaria treatment, we have to first do a very comprehensive health assessment, whereby this health assessment that one focuses on how the disease started, how the disease was presenting since we started receiving those symptoms. We also do some physical exam like taking your vital signs, temperature, such that we can now get a clear picture of what is really happening, such that we predict the potential investigations to do in order to prevent wastage of resources. That's why you see when you go to the hospital, those medics first ask a lot of questions. Please don't get discouraged with those questions. We just want to prevent wastage of resources, and we make the real diagnosis of your condition, not just rushing into investigations without first predicting what is really happening. Thereafter, after that, we can do different investigations, whereby you might find that in low level facilities, they always have those strips which you see where they prick your finger and they put there a drop of blood, and then they wait for some time. That one is one of the diagnostic investigation which we do, which is called malaria rapid diagnostic test, whereby it will just show that malaria parasites are there. However, we always encourage to go in facilities where they can do microscope. I don't know whether some of you viewing this program have ever seen those microscopes, but that's where they obtain your blood sample, they take it there. That microscope will magnify those small parasites which we can't see with our naked eyes, and this microscope is good in that it can also tell us the amount, or I can say the number, can tell us the number of parasites like you are having. They can try to tell us that one. That's why you will see that sometimes they can give you results saying malaria plus, or when they put 2 pluses or 3 pluses, just to indicate the parasite load you are having, whereby the more pluses, the more parasitic load you are having within your bloodstream. Those are some of the lab investigations we do to confirm malaria, such that we give you the proper treatment.
Thanks very much, Mr. John Baptist. So someone may be asking, you have talked about this plus and the triple plus, and you have told us that it shows the level of severity. So can you tell the viewer out there, when he has plus, what does it indicate? When he has plus, what does it indicate? When he has the triple plus, what could it indicate? Am I almost dying? Is it severe malaria? What could they be showing?
Okay, not to complicate things, those plus in simple terms, they are trying to indicate the severity of that disease. That is what I can say. Like when you're having a +1, that means your disease is not very severe, it is mild, it can be managed with a simple treatment, because we shall find that these pluses, why am I emphasizing microscopy, that these pluses, they also determine which treatment to be given, whereby when it is just a plus, we don't need to give stronger drugs which can now cause complications, just clearing the parasites within a few minutes and the drug, yet the drug is still there, which can also result into toxicity. Therefore, these plus, they are just telling us the severity of the disease, which we can base on to determine what is the right treatment to be given. Therefore, the less the pluses, the more mild the disease is, and the more the pluses, the more severe the disease. That is how, in simple terms, I can put it.
Thanks very much, Mr. John, for that elaborate explanation. So, when someone has been diagnosed with this malaria and you have confirmed he has either plus or the triple plus, as to you there in the hospital, how do they manage this patient? Which medications do you give? Which treatment do you give to this patient? And which other interventions do you give to these patients, like who have high fevers, who have the fatigues? Some actually, they go to even like feeling exhausted, they can't do anything, they become bedridden. So what are the treatments you do for people out there who present to the hospital with these infections? Thanks very much, Mr. John.
Okay, thank you, Mr. Tom. First of all, our major target is to remove the actual disease. Therefore, we shall, in case that disease is mild, no complications, of course we are going to give you anti-malarials, whereby even some of them, like the coatam, it, the diatep, those trade names. However, these drugs, we have to know the severity of the disease to know what medication to give, whereby they are categorized into different categories, where I have the first line, the second line. Like in most cases, when you go to the hospital early, you always given that drug known as coatam, which is just a mixture of a drug called artemether and lumefantrine, which are anti-malarials. Sometimes they can give you that combination of artesunate with amodiaquine, or that diatep, which is a second line treatment of malaria for those with severe malaria, which is just a combination of dihydroartemisinin and piperaquine. All those are anti-malarials, but we just give you those trade names since for them are easier to note. And when in case you get a reoccurrence of that infection, when you asked in the hospital which medication were you taking, you are able to recall that it was coatam, and we leave those other complicated names. However, we not only concentrate on the disease which is malaria, but you have to also see a patient as a complete whole. That's why we shall look at your body temperature, and in case it is beyond the norm, we shall also give some antipyretics, whereby we can give paracetamol for you to cool down your body. We can also give, depending on the situation you are in. Some of you can present with convulsion. That's just a simple fits, like those people where their bodies are like, can I call it shaking? We call them convulsions. We can also give anticonvulsants depending on the situation you are in. You can come when your blood sugars are also below the norm. Therefore, we shall give you some glucose. You can come when you've experienced like vomiting, diarrhea, loss of appetite, when you've been not eating, when you're having very low fluids within your body. We shall also give fluids. However, we always face a challenge that you find that after giving those treatment, we also give what we call non-pharmacological management. It's also a form of managing malaria, but you find that most of us, we don't follow it. We only consider those medications which are entering our bodies, but we have to also take them seriously. Like when someone is having mild malaria, you might find that that person doesn't need to be given fluids using an injection, and we encourage you to take more fluids. More you eat, you take a nutritious food. We tell you to take vegetables in case you see someone is what the color of the palm is started changing, because earlier I told you that this disease kills our body red blood cells. Therefore, we always encourage you to take vegetables, as they can help to synthesize those damaged red blood cells in a shortest time possible. Therefore, those are some of the interventions we can do, and so many others as medics, in order to manage this disease.
Yes, thanks very much, Mr. John. So a viewer out there may also ask, they don't know these medications, they are testing it for them whenever they have malaria infection and they're taken to the hospital, they put cannula, they just say my patient or my relative was put on cannula because of malaria. So all along it is artesunate they are giving. Thanks very much, Mr. John. So also viewer may be outside there, most people here are out there, whenever they get these signs and symptoms, they start taking Coartem. So this Coartem, which stages does it mean in manage of the malaria? Is it the plus, or the triple plus? Which stage of the malaria does it affect specifically?
Okay, this Coartem is a first line drug whereby it will manage a patient in the mild phase. Don't get confused with those pluses, cause those pluses, they also come with complications. It will depend how I presenting. For example, this Coartem, they will work in all phases, like when someone is having plus or plus, cause it's the first line of drug when someone is having mild malaria infection. All
right, thanks very much, Mr. John, for that elaborate explanation. So we come again away from the management and the treatment, we come to the complications. Some people often out there, after getting this malaria infection, they get the palms become the palms of the hand and the soles, they become almost they say pallor, or they lose their pink color and they become almost colorless. So what are some of the complications viewers out there should be aware of they will get due to poor management of this infection?
Some of the complications which can come with this disease, as I said earlier, and you've also talked about it, change of the color of the palm, which we call pallor. They become yellow, which can be mild or severe. That brings about the first complication, which can be anemia, severe anemia. That is when you're having reduced red blood cells within the body. That's why someone who is having malaria, we always encourage taking a lot of vegetables in order to prevent that complication. You can get hypoglycemia, low blood sugars, you can get convulsions, we talked about them already, you can get respiratory distress, you can get dehydrated, you can get circulatory system collapse, and so many other complications.
We have discussed about the prevention of this, the progress of this infection in your body, how it brings about these signs and symptoms. We have discussed about the treatment. We have discussed about the complications. So a viewer outside there may be wondering, asking him or herself, how can he prevent this malaria from infesting himself and also the family outside there? What are some of the preventive measures these people should do to prevent the malaria infection and keep away these mosquitoes away from their families or homes?
Okay, thank you, Mr. Tom. Like as I said earlier, we talked about the habitat for these mosquitoes, whereby we said that they like staying near stagnant water and in bush areas. Therefore, our sanitation is a key in preventing malaria infections, whereby we need to always clear away bushes and remove stagnant water around our homes. Always close our doors, close the windows. Also use some meshes within your ventilators to prevent entry of those mosquitoes, especially when it comes to evening hours, like at 5 p.m. you start at least closing all openings where you see mosquitoes can enter into our houses. You always put on long sleeved clothing, like before going to bed when it's already night. You can also, to those who can access some insect repellents, there are some insecticides which you can, creams which you can smear on your skin, and they repel those mosquitoes, preventing them from biting you. Or you can use some insecticides which you can spray, like there is this one which is commonly used, known as primathine, whereby you can spray your house, which can also kill those mosquitoes. However, recently we've got a very strong preventive measure where the World Health Organization, it was on 2nd this month, whereby there is a vaccine which is allowed, which is called R21, or the Matrix M vaccine, which can be vaccinated and help in preventing these malaria infections, whereby so far it has been tested in 3 countries in Africa, that is Nigeria, Ghana and Burkina Faso. Therefore, we have hope that even in Uganda it is soon coming, which is a very strong preventive measure for preventing malaria, especially in children.
To that same point, Mr. John, about this vaccine against malaria, how effective is this vaccine? And also, like, if someone gets a jab or an injection of this vaccine against malaria, how long has that research shown that it can keep someone off or safe from getting malaria infection?
This vaccine is highly effective. Its efficacy is high, whereby they said it is around 79% efficacy, whereby, and they have tried it to monitor in Nigeria, whereby after receiving all the doses, whereby it remained 12 months effective, whereby in Burkina Faso, where they have at least monitored for 2 years, they have said that after the first 12 months there was a need of giving booster dose. Therefore, that shows that the vaccine, it is effective and highly efficacious.
Wow, thanks very much, Mr. John, for that elaborate explanation about the vaccine on malaria, against malaria infection. Then also we have had a national wide rally against malaria where they have been distributing nets. What can you say about these nets? Like, there is always a belief, or like, actually it's not a belief, these medics always recommend people out there to first hang these nets before they put them on their beds. How important is that?
Okay, thank you, Mr. Tom. Actually, I had forgot that very important point as a preventive measure of sleeping under treated mosquito nets. You know the word treated. You don't just pick any mosquito net and you sleep under it. We need treated mosquito nets. However, we have to know how to use them. In case you've just received it when it's still new, you need to at least first hang it in under shade for at least 24 hours before starting using it. Then from there you can put it on your bed when the dose insecticide concentration at least had been lowered during those 24 hours of hanging it in under shade, whereby you can now use it effectively and for some good period of time.
Thanks very much, Mr. John. Almost as we come to the climax of the show, someone may want to know how severe or how expensive it is to manage malaria. So in case a person gets a child who gets malaria, how much money do you think they can spend on this child to treat this child to get back to normal?
Okay, malaria generally, managing malaria is one of the socio-economic problems whereby it is costly, whereby depending on the complication, because the cost can be even someone whose life whereby malaria kills. Therefore, the cost will depend in which stage are you in, whereby you will find that you can spend something not below 50k when you go to a private hospital and beyond, depending on whether it is complicated or uncomplicated. Therefore, managing malaria is costly. Therefore, I encourage you to always go as soon as possible before this disease has not yet come to its complicated form, such that you can reduce the cost of managing this malaria.
Thanks very much, Mr. John, for that elaborate and effective knowledge and information you have shared to the viewers outside there. We have been humbled to host you here on the Daktari show on Westnile TV. Thanks very much, Mr. John, for accepting our invitation to come to Westnile TV, specifically for this Daktari show. We have been humbled to receive you here today and hoping next time to invite you and hoping you also accept our invitation.
Okay, thank you, Mr. Sunday Junior Tom. I'm also humbled to be here today and hope the session has been very educative. Therefore, thank you all our viewers at Westnile TV.
Yes. Thanks very much, Mr. John. We come to the climax of the show. Meet again next Thursday, the same time, 10 a.m. to 11 a.m., where we shall be discussing more matters of health concern. Thanks very much. Have a blessed day and success in all activities you're putting your hands into. We're humbled to have you on Westnile TV. Thanks very much, our D4. And together with my guest, we say, Mungu Mako Maza. Thanks very much.
Bless you.
God bless you.